Welcome to the demonstration of Origin Speech. In order to use the product, just simply visit originspeech.com.au/speech. Enter your username and password and log in. When you log in, you'll be presented with your doctor work list. We recommend the first time that you use the program to change your password because the password provided is not highly secure. Once you've changed your password, I'll explain the doctor work list. You can filter by appointment date. You can search a patient name that isn't in your appointment list. You can see how many patients you have at a glance for today and how many dictations that you have completed. Your choice is to also send the dictation to the typist for checking, or alternatively, you can self-correct by just simply turning this feature on. In order to dictate, you just simply select the patient name, and what you'll see in the list is all of the templates you have in your information system. The first time you use the software, you'll see every template here. However, once you self-correct or send for correction, this list will change to have only one template available. If you wish to add more templates after you have completed the first dictation, just simply click on the search icon. You'll also see the default referrer called from your medical information system, as well as any CCs that you may or may not wish to use. For this particular dictation, all we need to now do is simply press click dictation. As we're in the mode of self-correction, you'll see a record button. Simply press this record button to start recording. The patient presents with small intestinal loops in the left hemidiaphragm in the upper left quadrant. Full stop, new paragraph. The mediastinal contours are within normal limits. Full stop, new paragraph. Insert cuff risks. Microphone off. You'll notice that I did the dictation. I said a few lines of standard text and then inserted an auto text or an insert text. We can set these up for you, so please do let us know. It's very important that the first 20 minutes of dictation is dictated and corrected by yourself in order to build a voice profile to save completing any training. Once you've checked this and ensured that the words are correct, you can then either cancel the letter if you no longer wish to have it, or press e-sign. By pressing e-sign, this will return to your medical information system as signed. Pressing e-sign now, as you'll see, the dictation has been removed from this list. I have now 3 patients remaining and I have completed 1 dictation for today. If I wish to then do a dictation for the back-end mode or send to the typist, I just simply turn this off, press on the appointment time and complete the dictation in the same fashion. However, you will note that there is a recorder on the screen. In order to dictate, all I do is simply press record. The patient presents with small intestinal loops in the left hemidiaphragm in the upper left quadrant. Full stop. The patient presents with small intestinal loops in the left hemidiaphragm in the upper left quadrant. Full stop. I'm happy with what I've recorded. If I wish to re-record and delete over that, I most certainly can, or else I can just simply press record to continue recording. If I'm happy with what I've said, I'll send that for review, or I can cancel the letter. And you'll also note there's a priority tab where you can select either normal or urgent. In this case, I'm going to send for review. And once again, you'll see that this list has now come down with 2 letters completed and 2 letters remaining. This particular patient may not have attended, so in this case I can remove the patient from the list. And then I can see I have 1 final patient and I can continue to dictate for this particular patient as well. You can also select the CCs, and once again you can search for the CCs. All of the fields have search criteria listed next to them. If you wish to see the dictations that you've completed, there's the dictation work list here, and this will show the dictations that we've completed and the statuses of where they're completed. So we can go in and have a look at the text or listen to the audio if we so desire. This text here, once reviewed by a typist, the name of the typist will appear here, so you know that it's been reviewed, and that will go back into the medical application. It's a very straightforward program, and obviously we welcome your feedback in relation to it.